Hello, and thank you for joining us for our session on unique needs of the LGBTQIA plus community. My name is Debbie Fink. I am the Interim Vice President of Patient Programs and Education with ZERO Prostate Cancer. We want to acknowledge and celebrate Pride Month and the unique experiences that the LGBTQIA plus community has in seeking healthcare. We're looking forward to hearing more from our distinguished guest, Dr. Dustin Nowaskie, momentarily. Now, please join me in welcoming Dr. Dustin Nowaskie. Dr. Nowaskie is a queer, non-binary psychiatrist. Their personal identification and civic commitment have cultivated into a passion to help LGBTQ plus communities. They are the founder, president, and chief medical officer of the national nonprofit LGBTQ plus health equity organization called OutCare Health, which provides access to LGBTQ plus information, resources, programming, mentorship, education, training, research, and providers for millions across the world. And we dropped the link in the chat box for you. A summa cum laude and Phi Beta Kappa graduate of the University of Southern California and Gold Humanism Honor Scholar of the Indiana University School of Medicine, Dr. Nowalskie's clinical and philanthropic work has led to several national accolades, presentations, and publications. In addition, they have received diversity awards, no surprise, from the Jack Kent Cooke Foundation, American Medical Association, Tylenol Future Care Foundation, Gamma Mu Foundation, Association of LGBTQ plus Psychiatrists, World Professional Association for Transgender Health, and Out to Innovate. Their ultimate goal is to transform their might into a powerful unicorn of social and public health change for LGBTQ plus people. Thank you, Dr. Nowaskie, for joining us today. And it's my pleasure to hand the virtual mic over to you.
Awesome. Thank you so much, Debbie, for that wonderful introduction. I was smiling and also reminding myself of how many years of work and challenges and triumphs it's been. All of that you just spoke about in my bio has been the collective work of about a decade, about 10 years. And so I appreciate you letting everyone know kind of my background. First and foremost, before we get started today, I want to thank everyone for their time, whether it's live or watching this recording. I want to acknowledge and welcome that all of us have unique identities and backgrounds and lived experiences. And I want this to be a safe, affirming space as much as it can be. So if you have any questions today, if you're watching live, please post them and we'll get to them at the end of the discussion today. And I also want to acknowledge that several points that I'm about to discuss, they may be dismal and they may be triggering in some way. I'm tasked with talking about LGBTQ plus healthcare in about 20 to 25 minutes, which is a daunting task, given that I do this work every day. And it could probably take me weeks and weeks to talk about all the ins and outs and the nuances. But while I'm about to present what might be unfortunate reality that LGBTQ plus people face, I do want to prioritize our discussion with hope and action for a better future and a better world. And we'll talk about how we can take all of what's happening in these gaps and turn it into positive change. So again, I want to thank you all for your time today. Okay, make sure I can advance these slides here. Okay, perfect. So like I said, today we'll be discussing unique needs of LGBTQ plus communities. And healthcare systems, as you may know, they present very significant systemic challenges for LGBTQ plus people. As you see here, there was a lot going on when we think about the LGBTQ plus health landscape. There is a lack of affirming care, there's limited resources, there's implicit and explicit biases that unfortunately create environments where LGBTQ plus people, they consistently face very strong barriers to equitable healthcare. These issues, they're not isolated. They reflect very deep structural inequities that ripple across many, many landscapes within healthcare. And unfortunately, many LGBTQ people avoid seeking care altogether due to very unwelcoming or discriminatory environments that they face sometimes on a daily basis. These environments, they lead to large gaps in care, they lead to higher emergency department utilization, and unfortunately lead to the development of preventable chronic conditions. And these structural issues, such as insufficient training, financial disincentives, fragmented systems, they compound these problems astronomically, and they leave many, many healthcare staff and providers unprepared to deliver affirming care. And as you can imagine, these systems within healthcare, they are very unsupportive. They're inequitable, and they can lead to very serious consequences. The gaps translate into higher rates of physical and mental health conditions, greater reliance on emergency services, and elevated rates of suicidality. And so when I think about LGBTQ plus healthcare and these disparities, they really do reflect healthcare systems that are not adequately trained to respond to the needs of LGBTQ plus people, which absolutely means that systemic reform, not just on an individual level, but as a community, as a workforce, is really not only necessary, but it's urgent. Okay. And as you also may know, stigmas against LGBTQ plus people, they are quite pervasive. They exist across all areas of life. They manifest in many contexts, including interpersonal, institutional, community, and policy. And all of these contexts create barriers to safety and equity and overall well-being. And we see this play out over and over and over within educational, occupational, housing, healthcare, political, religious, and faith-based institutions. These are all spaces where LGBTQ people can encounter discrimination. And within those contexts, stigma often can come from many range of sources. So it could be from peers or coworkers or family members, friends, partners, even. And we also see that there's stigma and discrimination from healthcare staff and providers. And there are certainly many common forms of stigma that LGBTQ people face, including homophobia, biphobia, transphobia, interphobia, and all of these forms of discrimination, they reinforce exclusion and marginalization, unfortunately. And this very, very widespread presence of stigma really shows us that we have to be much more proactive in our efforts so that we're creating affirming spaces as much as we can. Okay. And just to take this a little step further, so as I mentioned, LGBTQ people, they do face very pervasive systemic discrimination that create a lot of barriers. And stigmas are heavily embedded into our society. So if you look at data that's been really collected over the past 20, 30, 40 years, we're seeing the same rates, unfortunately. And in that about half or slightly over half of LGBTQ people experience social marginalization, including things like unsupportive families, mistreatment in schools, trauma, abuse, unemployment, financial instability, housing instability, mistreatment by law enforcement. It's just, unfortunately, it's very, very pervasive. And all of these challenges compound and leave many LGBTQ people without any resource at all. And the same is true within healthcare. So if you look at healthcare, we see that stigma is just as prevalent. As you see on this slide, more than 25% of LGBTQ plus patients report experiencing some form of healthcare discrimination. And this can be stigma from providers or staff. It can be a refusal of care. It could also be specific forms of trauma or abuse during medical interactions. And we also see that the stigma on a social level also is compounded at a political level. There are high rates of anti-LGBTQ plus legislation that have been increasing at an alarming rate. So if you look over the past 3 years, 2023, 2024, and 2025, there have been over 500 bills and bans that have been proposed against LGBTQ plus people. And within those bans, nearly 100 of them target healthcare each year. And the ACLU tracks these ban proposals every year. And I looked at their website a couple days ago, and it's well over 500, and we're only halfway in the year. And we expect, unfortunately, that this will be the highest year of anti-LGBT legislation that we've ever witnessed. And unfortunately, these laws, they absolutely impact and restrict access to life-saving, gender-affirming care. And they don't harm just health outcomes. They worsen societal stigma, they decrease safety, and they push many LGBTQ plus people to consider life changes, such as leaving their state or even leaving the country for concern of their safety. And LGBTQ plus people face a lot of barriers from their healthcare providers, which leads to lower quality of care. And so, as you see here on this slide, this is an outcare study that we did some years ago, which really revealed the extent of these disparities. LGBTQ people were telling us that they are much, much more likely to say that their provider didn't listen carefully to them, didn't show them respect, didn't spend enough time with them, lacked necessary medical information, or even failed to provide a level of care that they expected for their health. And unfortunately, LGBTQ people were 3 times more likely compared to cisgender heterosexual people to describe that their care visits were poor overall. And perhaps one of the most harmful experiences that we noticed in the survey was that uh, twice as many LGBTQ people were saying that they were misgendered or dead named compared to cisgender heterosexual people. And these are simply visits between their doctors, right? People that they should and hoped to believe that they would trust the most. And unfortunately, these negative interactions, they erode trust, they perpetuate harm, and they absolutely discourage people from engaging in their care altogether. And another study that we did is on this slide. And so we wanted to look at what are the levels of stigma and distrust amongst LGBTQ plus people. And again, you kind of see the same narrative here where many, many more LGBTQ people are telling us a high level of disparity. This study found that gaslighting is reported by nearly half of LGBTQ plus people compared to just 1/4 of cisgender heterosexual people. And we also saw very high rates of medical related trauma as well. About 1/5 of LGBTQ plus people were reporting trauma. And essentially, it was trauma across the board: emotional, physical, and sexual traumas. But all of these negative interactions, they lead to a very high level of pervasive distrust. So as you see here on this table, we asked LGBTQ plus people and cisgender heterosexual people, do you trust your primary care doctors, your medical specialists, pharmaceutical companies, insurance companies, and the system itself? And as you can see here, very, very high rates of distrust among LGBTQ plus people. And I just want to draw your attention to, pharmaceutical companies, insurance companies, and healthcare systems. These are very, very high rates. Over 80% of LGBTQ plus people are telling us that they do not trust these systems because they do not validate them. They feel very inferior to them, but also they're not represented in any way. And as you can imagine, there's, this pervasive stigma. It's unfortunately here to stay, and it's been here for quite some time. And there's a trickle-down effect. It leads to profound consequences for LGBTQ plus people in their lives, and especially their healthcare. It affects every aspect of accessing and receiving care, which does lead to very serious social and healthcare outcomes. This is another study that we did some years ago, and what we found was many LGBTQ people face very significant barriers when they're trying to navigate their care, whether it's financial challenges, issues with transportation, scheduling, accessing medicines, you name it. I mean, it was consistently a high level of disparity no matter what we asked. And this situation, it's very dire. It leads to people avoiding healthcare altogether. But it also unfortunately leads to high rates of physical and mental health conditions. We see very high rates of heart disease and cancers, but also essentially all mental health conditions, including depression, anxiety, PTSD, eating disorders, are at a much, much higher rate for LGBTQ plus people. We also see very high rates of substance use disorders and substance use, as well as suicidality. And people ask me all the time, what is the rate? Well, I usually tell people if you know a rate of a general population statistic, multiply it by at least 2 to 4, and you have the rate of an LGBTQ plus communities. But unfortunately, we know that for some subgroups of LGBTQ plus people, for instance, people who are bisexual, people who are LGBTQ plus people of color, and especially trans women of color, have much, much higher rates of disparities. Sometimes the rate is times 8 to 10 the rate of cisgender heterosexual communities. And I bring this up because, these are very real statistics that have really not changed for decades. And it is very clear that there are systemic barriers, that it's not just a matter of equity, it's a matter of life and death and improving one's health and overall well-being. Okay. And I recognize that you all are here to talk about the intersections of prostate care and prostate cancers. And so I wanted to spend a little bit of time on, if we're thinking about LGBTQ people with prostates, what should we consider? And when it comes to prostate cancer, there unfortunately are a lot of misconceptions, especially around the actual healthcare maintenance and follow through for LGBTQ people with prostates. And so, for instance, I hear this all the time, actually, from queer individuals, from LGBTQ people that have been told these things by their doctors. I've also had many colleagues ask me these questions about risk factors and how to appropriately care for LGBTQ people with prostates. And there's a lot of assumptions, a lot of miscommunication out there. And for instance, sexual orientation, oral sex, anal sex, these are not risk factors for prostate cancer. But unfortunately, this dialogue has perpetuated within LGBTQ plus communities. And the biggest piece of evidence and information I can give you is that LGBTQ people with prostates, they are not at a higher risk simply because of their identity. One's identity is not a risk factor for any for any really healthcare condition. It is for LGBTQ people, it is the stress and discrimination that they face that's the risk factor to lead to poor health outcomes. But unfortunately, research has shown that LGBTQ people who do get prostate cancer, they often experience worse health outcomes. So, for instance, they may have impacts on their intimacy, physical and mental health, but also overall quality of health we see is at a poorer quality compared to cisgender heterosexual people with prostates. We also see that treatment side effects, they can actually be particularly challenging as well in slightly different ways for LGBTQ plus people. This may include erectile dysfunction, changes in rectal or prostate sensitivity, a loss of ejaculatory function, or difficulties with anal sex after the prostate is removed. And I recognize that I'm talking about this in a very high level, broad stroke because LGBTQ people represent hundreds, if not thousands, of various beautiful identities. But if we think about gender diverse people, we know that there is very limited data in general for LGBTQ plus healthcare. But we also see that there is very limited data when we're thinking about gender diverse people with prostates. And so it is very hard to make or provide informed care for gender diverse people with prostates because simply the data isn't there. And I guess the question is, why do these disparities exist for LGBTQ plus people with prostates? And unfortunately, there's a lot of barriers. There's things like stigma, discrimination, fewer screenings, providers who aren't trained in LGBTQ plus affirming care. Clinics are quite gendered in their name. Clinics and hospitals don't have inclusive forms. There's assumptions that are in electronic health records. All of these discourage people from seeking care in the first place. And as you all probably know, navigating cancer screening, it's hard. It's hard enough for anyone. And especially for LGBTQ plus people, it can feel like the system wasn't built for them. And because more often than not, it wasn't, and it still isn't. Um, and so it's unfortunately, a dismal narrative. And there's a lot of ways that we can improve care, especially for people with LGBTQ people with prostates. It's a lot more than just educating LGBTQ plus people. It really has to do with equipping healthcare providers with tools that they need, such as organ inventories to help guide screenings, and then also longitudinal training so that we can provide the best affirming care as much as possible. And I guess the thing that I want to leave you all with is that better prostate care, it starts with equity and it also starts with respect. Okay. And I recognize, it's a lot of information. So I just want to present, like an idea of like what reality could be. And so, LGBT plus care, it's an opportunity for it to be visible, to be accessible, to be affirming. And ultimately, I hope that there could be a world where every LGBT plus person feels heard, seen, respected, and affirmed. And so I just want to spend maybe one more minute just talking about OutCare and what we're doing, and then I would love to open it up to any questions. So if you have any questions or thoughts, please feel free to post them in the chat as we're kind of wrapping up today. But with all these disparities in mind, I want to open up an opportunity into my life and why I started OutCare. I started the organization about 10 years ago for a lot of reasons, including, lack of accessibility for LGBTQ plus people. And that was many years ago. And as Debbie said, we're doing a lot in the world and a lot for LGBTQ plus people. But ultimately, our goal is to create a world where every LGBTQ plus person has access to quality healthcare and they feel empowered to live their healthiest, most authentic life. And the way that we do that through a lot of capacities. So we have a community health resource database where we vetted resources. We have the largest affirming provider directory in the world with about 6,000 providers that have education, experience, and especially identity and lived experience in LGBTQ plus care. We do a lot of training, a lot of education, consulting, and we have a lot of programming for LGBTQ plus people that they can tap into. So this slide, you just see the outlist. Like I said, the outlist is the largest affirming provider directory in the world. If you are looking for providers yourself or you're a provider, feel free to join. But also this is a great referral system. So if someone is looking for a primary care doctor, a mental health provider, they can go to the outlist and find a provider within their town, city, or their state. Like I said, we do a lot of training and education, so you can tap into our organization for that. We have 28 on-demand modules. We deliver our own care navigation. So if you're ever needing to get a little bit more information or guidance on how to access healthcare, you can reach out to us. Like I said, we do a lot of research. We have a webinar series, a mentorship program, and a resource database. We also have blogs to keep you up to date on the news and views of LGBTQ plus care. We have our own support groups, and we have a lot of volunteer efforts across the country. Here's just some quick stats on what we're doing and where we exist in the world. Like I said, these numbers change every day, but like I said, we have about 6,000 providers on our directory. They represent all states in this country and 10 additional countries outside of the US. We do a lot of training. We're training tens of thousands of people every year. And we have a lot of people coming to our website, roughly about 25,000 or 100,000 views to our directory alone. And we work with a lot of groups, including healthcare insurance companies and hospitals and clinics, so that we're amplifying everything that we're doing every single day. And I just want to leave you with this, kind of tagline that we have. We hope that we're elevating LGBTQ plus people as much as we can. By no means am I able to do it on my own. I have a full team with hundreds of contractors and volunteers across the country that really have elevated the vision that I had 10 years ago. And so I want to invite you into the OutCare Health family. If you ever need any of our resources, please reach out to us anytime. If you're ever interested to join our efforts, please let us know. Because it takes a village, it takes a whole world to pave the way to a more affirming and equitable healthcare future. But I do thank you all for your time today. I will put my email in the chat. If you ever want to reach out to us, please do so. And if not, I hope you have a wonderful month. Happy Pride, and thanks for listening in today.
Wow. Thank you, Dr. Nowaskie, for such an informative presentation. There's a lot of work that needs to get done. I also want to share that on Thursday at 7 p.m. there will be a support group roundtable for the LGBTQIA plus community. So we're now going to our audience submitted questions. Don't be shy. No, there's always, any question is a good question. And we will start with this one. Is there a directory somewhere that lists affirming LGBTQ plus providers, clinics that focus on cancer care, specifically urological care?
That's a wonderful and great question. So I will post the direct link to our directory that I said, the out list. And so we have all kinds of providers on our directory. We have actually 50 different specialties that are represented on the directory. We have many, many people that are in family medicine, internal medicine that are doing great work in the cancer space, especially prostate cancer. We have a lot of urologists on there as well. And so please check out the out list. If you're looking for a provider yourself, or also you need it for referral reasons, it's very easy, navigable, and everything in provider profiles is searchable. So if you're searching for specific types of care or specific specialties, you can always search those keywords, and those providers that deliver that care will show up.
Thank you so much for that comprehensive response. Immediate resources at your fingertips. Okay, next question. Can you address those with prostate cancer in the LGBTQ plus community who also have additional intersectional identities, such as and African American identity
Mm.
that further exacerbate inequities in healthcare?
Yeah, that's a great question, and absolutely a very timely, but also a needed question, because healthcare systems, unfortunately, historically have not addressed what I think you're alluding to, which is intersectionality. So I didn't have enough time where I would have put a slide on intersectionality. It's a very complicated and very complex and intertwined thing to understand. And I will admit that years ago it was considered very academic to talk about intersectionality, but I try my best to kind of pull away and, kind of speak to everyone of what it means. And so, to your question, all of us, we all have a spectrum of privileges and disadvantages. Sometimes those are attached to our identity, sometimes they're attached to our experiences or education, et cetera. Unfortunately, what we see is that if you kind of segment out, the experience of, say, an LGBTQ plus person based on their sexual orientation or gender identity, we see that there are high rates of disparity. We can also look at identities such as racial identities or ethnic identities, and we can see the same narrative play out, that unfortunately there is disparity because of how someone identifies in their race and their ethnicity. Now, the question is someone at a higher risk if they are, say, an LGBTQ plus person of color? Potentially. Some of the data does support that there are much higher rates for someone who is an LGBTQ plus person of color versus someone who's an LGBTQ plus person who's also white or Caucasian. It just depends. It is very nuanced, and it depends on a lot of factors, including resiliency and protective factors and experience. But it is the unique experience of all those identities that matters to an individual person. So whenever I'm educating providers and systems, I say, please do not blanket statement. Please do not assume that someone has a higher rate of disparity based on specific identities or the combination of them. You really have to tailor it to what I consider as identity-centric or identity-centered care to really understand each identity and the summation of those identities and how it impacts their care. So it is a very
Thank you.
complicated question, but thank you for asking.
Thank you so much, so much. We need a webinar just on that.